You're listening to the Beyond Measurements and Image podcast, where we build healthier lifestyles, elevate your well-being, and transform lives. Welcome to BMI.
I'm your host, Dr. Drew Crawford. I'm a board-certified gastroenterologist and obesity medicine specialist. Thank you for joining me today on Beyond Measurements and Image. Today, we're going to talk about the role of financial health in general health and wellness. On previous podcasts, I've briefly mentioned the concept of financial health. You might say to yourself, well, what does one have to do with the other? But it's interesting, there's been a fair amount of studies that correlate the two. It's well known that there's a correlation between poverty and the association of higher rates of obesity. And we see that most commonly in high-income countries like the United States. It's known as the poverty-obesity paradox. It doesn't seem to make sense on the surface that in a higher income country that you would have a lack of resources that ultimately would lead to overnutrition. You would think poverty would lead to undernutrition, malnutrition, but actually it's different in countries like this. Now, there are third world countries where a lack of resources do lead to malnutrition and all the associated health consequences of that. But in higher income countries like the United States, we tend to see a paradox where it leads to overnutrition. Why is that? Well, there's multiple reasons. One of them, and probably the biggest one, is kind of what we know as food deserts. And that's where people live in an area of a city or, maybe even a rural community where they live in an area where they don't have access to good nutrition. In other words, let's just say you live in an area of town that has a high crime rate. So the grocery stores don't want to open up a regular supermarket there. So what happens there is then you end up with a bunch of convenience stores and fast food markets. What we know is that the profit margin of grocery stores is quite low. And so if you have an area of the city that's high crime, which would lead to a lot of increased theft, and you're dealing with a business that has very low margins, they can't tolerate much theft in their store. So what happens is they just choose not to open stores in that. By contrast, if you have convenience stores, their margin is significantly higher. But the difference is they don't sell really nutritious foods. They sell a lot of high calorie dense foods, a lot of processed foods, candy bars, snacks, potato chips, Coke, sugary beverages. And the same is true with fast food restaurants. Their profit margins are greater, so they can sustain a little bit more loss and they're willing to take a little bit more risks. So convenience stores and fast food restaurants oftentimes are the only source of nutrition in these, quote, food deserts, end quote. When you take that on the whole, what happens then is you have these people that live in these areas where there's food deserts. So just almost by definition, they're poor to begin with. And so we know that there are societal determinants of health, and finances is one of them. So you take these people and they're poor to begin with. And so they probably, more often than not, they were likely raised poor. So they have generational poverty as well as the generational consequences that go with that, particularly obesity and chronic illness. And then they continue to live in these impoverished areas because they haven't been able to break the cycle to get out of it. So they may have a little bit of a propensity to be unhealthy and potentially to have bred with people in the same geographic region who not only don't bring a better gene pool to the mix, but also don't bring more health literacy or even more education to the mix. And so the cycle just perpetuates itself. So they just continue to eat at the convenience stores and the fast food restaurants. And that's not to say that they eat all their meals there, but they probably eat more than they should. And oftentimes they don't even have access to adequate transportation. So they're not able to go somewhere else. So maybe they have to walk to the store, which that's not bad, but that doesn't exactly lend itself to bringing home groceries to have at the house to cook. It's definitely more complicated than that, but that's part of it. Either way, even if you have people who don't live in food deserts, but are just broke for whatever reason, either they don't make enough, spent too much, they have too much credit card debt, they've had to file bankruptcy, whatever the cause is, oftentimes they're just worried about paying the bills. They're just worried about getting the rent paid, getting the electric and making the car payment, water payment. And so they just don't prioritize affordable, healthy foods. And so they go with the more energy dense processed foods that are cheaper. Again, it just sort of perpetuates this cycle because a lot of those foods are just super high in sugar. They're oftentimes very carb rich. They don't have a lot of protein. They don't have a lot of fats, and they just have very little nutritional value. And then thirdly, there's also this concept of food insecurity. And again, that's for the very impoverished where they may just not have food at all, or they just go to bed without meals. And then when they do have food, they probably overeat in an effort to sort of bank whatever nutrition that they might be able to get. And although that's not exactly a perfect cycle, but that can occur, and it does occur, that ultimately can lead to some weight gain. Combine that with the fact that if you are just sort of chronically ill, you're probably not particularly active in terms of lifestyle. You're not exercising, you're oftentimes not going to the gym. And maybe if you live in these food deserts or these more dangerous neighborhoods, you may not want to go out, right? There may be parks in the area, but you may not want to go to them. And so you may just become more reclusive, stay in your house, and the cycle just perpetuates itself. And it's unfortunate because it hits not only our most vulnerable socioeconomically, but oftentimes it's divided on racial lines as well. Oftentimes in neighborhoods like this, you don't have good recreational facilities, and sometimes the schools don't offer all of the sporting activities that maybe some of the other schools might potentially offer. Again, combine all this with the fact that there's just a lot of social stress that goes with being poor. When that happens, a lot of times you just don't sleep well. And let's just say in the example of a kid, if he doesn't sleep well, he doesn't make it to school on time, or he makes it to school less, he's less present, or when he is present, he just isn't as engaged because he's tired, which then again leads to poor educational outcomes, which just inhibits him or her from then furthering themselves and being able to break that cycle and get out. So you can see it's all a very complicated cycle. Now, I definitely don't have the answers as to how to handle all of this, particularly the incredibly poor that we're talking about here. But let's just say people who maybe don't have a lot of excess, but they do have some means. But maybe they've just made bad decisions. So financially, they don't have food insecurity. They don't necessarily live in a food desert, but they do make poor food choices because oftentimes the less healthy choice is the cheaper choice. And let's be frank, if you look at eating healthy, it is more expensive, right? If you go to the store and buy fruits and vegetables, it's definitely more expensive than going down the soup aisle and buying a can of soup or crackers or cereal. To have a salad is much less energy dense than to have a bowl of cereal, right? So someone eats a bowl of cereal, they feel full. And if you're sort of on the brink of, having just enough money to pay the bills, you're going to want to feel full. So you go get a cereal, you feel more full. You may do a little better because you've got more nutrition, but consequently you've taken in a lot of carbs, which oftentimes over time will lead to obesity, as well as all the chronic health conditions that lead with that, including heart disease, arthritis, stroke. And then, is the possibility of mental health issues, not so much dietary related specifically, but just situationally related. So aside from people that are in food deserts and situations where they're just massively poor, let's just take a person who has a job, who has insurance with that job and struggles to pay their bills. Maybe it's because they've overbought their house. Maybe it's because they have too much of a car payment because they've overbought their car. Maybe they just don't save well. Maybe everything they get, they spend, right? And all these things end up ultimately with a similar outcome, because then when nutrition comes in, if they don't prioritize it and they don't have an intention to eat healthier, then oftentimes that's the way they go about saving money. In addition to all the typical things that we as Americans do that just lead us into poverty, the number one reason for bankruptcy in the United States is medical debt. So it's ironic. The choices we make that oftentimes lead to poor health outcomes, those poor health outcomes then ultimately lead obviously to poor health, which then requires doctor's visits, hospitalizations, and procedures, which then in turn compound not only the poor health, but then in turn lead to the number one cause of bankruptcy in the United States. In 2019, a study from the American Journal of Public Health published a report, and they said that about 66% of all bankruptcies in the United States are related to medical debt. And so that's not just people that are uninsured, right? There's a lot of people that are insured, but maybe they have inadequate insurance, or maybe they just don't have a job that has insurance at all. Or if they do have insurance, their portion of it, they can't pay for it. So then in 2010, right, they had Obamacare, and that was supposed to really resolve everything. And there probably was some general outcomes of Obamacare that was good. But globally, what we know for sure is Obamacare has not lowered overall healthcare spending in this country. Now, from a government perspective, it has slowed the spending growth that the government spends down from about 6.9% in 2010 to about 4.3% in 2017. So we've seen some improvement in the trajectory of healthcare expenditure by the government, but that doesn't necessarily lead to anything on the individual level. And in fact, I would argue that Obamacare actually has done a fair amount of damage. I don't necessarily want to say that it's completely bad. I think there's a lot of things about it that are good. It has led to the ability for kids to stay on their parents' health insurance up to age 26, even if they're not living at home. And it also has provided a means for access to insurance when you have pre-existing conditions. The way an insurance company works is everybody pays in their premiums. That's the amount that you pay each month. And the insurance company takes that money and pools it all together, and then they invest that money. The plan is that the investments will pay off. The insurance company will grow that money from the premiums. And then in turn, when people do have expenditures and they file a claim, then the insurance company has excess money to pay that claim. So that's a general overview of how health insurance works. Now, there is a lot of talking about how evil healthcare companies are, and they do actively deny a lot of claims. And I think they are just trying to be diligent with making sure that they're using their resources right. But it's a little bit sketchy when they're denying it. But when you think about it this way, let's just say that your healthcare premiums are $1,000 a month. In the first month, you go in and you have let's just say a knee replacement, and that's a $30,000 surgery. And I'm completely making up these numbers, but you've paid $1,000. And so the insurance company then in turn is paying out $30,000. So you can see where that's not a sustainable model. And so they have to do what they have to do to take that money and grow it, but they also have to try to regulate their expenses. Now, I am the last person that's going to advocate on behalf of an insurance company. I'm not saying what they do is right or wrong, but they do pay their CEOs an inordinate amount of money, and they're publicly held companies that pay dividends. So there's something to be said about that. But that's not the point of this podcast. What we know is prior to Obamacare, there were multiple insurers. And so we've seen a significant consolidation in healthcare systems and in health insurers. So before there were a lot of smaller insurance companies, but of course, like anything, when the government gets involved, there's a lot of increased regulatory burdens that basically have forced those smaller insurance companies to consolidate into bigger companies. And then you add to that the fact that these bigger companies now are getting subsidies from the government. That becomes quite lucrative for them. So they really work hard to meet the metrics, but they're big enough that they can do that. And so really we're down to about 4 or 5 major insurance companies that are running a big portion of the healthcare industry in terms of insurance in this country. So you would think with the insurance companies consolidating and being subsidized that they might somehow be able to figure out how to lower premiums and how to lower expenses. But in fact, what we know is in 2025, there's been about a 7% increase in premiums and healthcare expenses to the individual. And in 2024, there was a 6%. So this consolidation of power into just a few organizations never cut costs, right? It's always proposed that if we do this, we'll cut costs, we'll have economies of scale, and that by doing it, by just having, one administrator doing all of this instead of having multiple administrators across multiple insurance companies, it'll be cheaper. Somehow that doesn't work. In addition to the insurance companies consolidating, what we know is between 2010 and 2017, there were 778 hospital mergers. And then we also know that the number of hospitals that are in large systems now, where there used to be smaller hospitals, maybe even like rural hospitals, they were just independent. Oftentimes they were run by the city or the county, or maybe a small private company, or they might have been a private entity in and of themselves. But then what happens is they start getting gobbled up by these big healthcare organizations, Ascension, Mercy, CHI, there's a whole host of them, HCA, Kaiser Permanente. And again, you think, well, gosh, bigger is better. But that's not really the case. But what we know is between 2010 and 2017, the number of hospitals that are a part of a large system went from 53% in 2010 to 66% in 2017. And that number is probably higher now 8 years later. With that, these big organizations, they look to see where they can make more money and where they can make more margin, because in the end, this is a capitalist society, and that's kind of how we're wired. But what are the consequences of that? Well, what we know is that hospitals that have no competition within a 15-mile radius tend to have pricing 12% higher than hospitals that don't meet that criteria. And when you have two hospitals in the same state that merge into the same healthcare system, those prices tend to rise approximately 7 to 9%. So all that to say that Obamacare may have brought in some benefits, but ultimately those benefits require subsidies from the government. And then along with those subsidies comes significant regulation. That regulation then led to a decreased number of insurers and hospitals. And then you have fewer and fewer people in control with more connection to the government, more money, more power. And it just seems to be a bit of a vicious cycle. So again, the commentary on that is not necessarily the role of this podcast, but it's just to show you that healthcare costs are spiraling out of control and they're really unsustainable. When a person is just flat broke and they can't even figure out how to eat, right? I don't have the answers for that. I don't have the answers for any of this. But when you're working a job and you have insurance and your premiums keep going up, and you know for a fact that your financial health correlates to your overall health, we have to be able to kind of look at that at some level and just look to see what are some of the things we can do to get ourselves into a better financial position that ultimately will help us to get into a better overall health position. So let me just talk about one quick study just to kind of reinforce what I've already said about the financial health and our overall physiologic health being correlated. So in 2022 at the University of Kansas, they published a study titled, "Is Financial Capability a Determinant of Health? Theory and Evidence?" It was a well-written study. And in the end, basically what they said is that definitely your financial capability had a strong impact on your health. There were some flaws to the study. They had a measurement model of financial capability and health, and they looked at if you had a checking account, a savings account, a retirement plan, credit card, if you were good at math, if you had some sort of financial literacy, some knowledge. But then on health, they asked questions about your life satisfaction. It was a self-rated health question. There was questions about depression, whether or not you were worn out or whether or not you were happy. Then they tried to correlate those questions that they asked about financial capability along with the health status. The problem is the health status, just generally a self-reported, how do you feel? Are you happy? Are you tired all the time? Are you depressed? What's your overall health? Which people have a general idea, but you don't know what your blood pressure is necessarily. But definitely if you're not going to the doctor, you don't know what your blood pressure is. You don't know if you have polyps in your colon, if you haven't had a colonoscopy. You haven't really drilled down on some of the true physiologic parameters that really matter. I'm not nitpicking, it's good, but it is a study that correlates the two basically as a determinant of health. One last thing, and then I'll get off this. So if your finances are such that your diet suffers, then oftentimes your follow-up physician is equally as poor, right? So then you may have fewer preventative tests, colonoscopies, mammograms, prostate exams. You may not go for yearly appointments. So things that might be detected early don't get detected. And then what happens is you end up with more advanced disease. And we know that people who are more impoverished are diagnosed at later stages of almost all healthcare metrics. And so it's just a self-perpetuating cycle. The point today is just to kind of discuss the fact that financial health matters. And you can't fix financial health overnight. It's as daunting as something like obesity, right? You can't fix obesity. You can't fix poor health and you can't fix finances all overnight. But it's definitely one of those things that if you start today and you're just consistent and you just do little things to kind of move the needle forward, it ultimately can make a difference. And it can make a difference, and that difference can be self-compounded because if you're healthier 10 years from now, not only financially, but just globally healthier, then you likely are going to have fewer expensive medical procedures that become necessary. You're going to have fewer impacts on your health that are going to take you out of the workforce, right? It's just, again, everything that I talked about in the first part was talking about how the negative consequences of finances ultimately lead to negative health consequences. But the flip side of that's true as well, right? If we start now whittling away and making decisions on our financial health, those can impact our physiologic health. And in the end, that snowballs as well in the same way. So what do you do? What's the action? Well, first of all, as the BMI podcast continues, we will have guests on to talk about financial health. We'll talk about different avenues. And I know they don't apply to everybody. And finances are definitely one of those things where people are all over the spectrum. But hopefully you'll be able to find an area where it kind of fits your need and can kind of help groove you into that situation. But just like everything else we talked about, the key is to start and to be consistent. Probably the first thing you need to do with financial health is just kind of determine where your finances are. What is your overall net worth? Is it positive? Is it negative, right? Net worth is everything you own and its worth minus everything you owe. Is that number positive or is that number negative? So that's a good place to start. And then start tracking your spending. If you could just follow your spending, and there's tons of apps out there that'll help you with that. And there's so much money that gets spent just on frivolous things, Maybe it's a $5 Starbucks coffee or wherever your coffee house is. Maybe it's eating out too often. Maybe it's drinking alcohol, right? Maybe you just go out too often, or when you do, you have too many drinks and it's just expensive. Everybody's different, but there's almost always room to trim. A lot of times it's just these little luxuries and you just think to yourself, well, gosh, what does it matter? Maybe you think I'm broke anyway. I got enough money to have this cup of coffee. What the hell? I'm just going to have it, But big changes ultimately start as small changes. And so you just make these little small changes. And each day it doesn't necessarily feel like a big difference, but over time it does. So the first thing is just track your spending. Kind of like we talked about, like MyFitnessPal and all that, tracking your health. Just start tracking your spending. You don't even have to, for the first month or two, you don't have to make any changes. Or maybe what would be even better is if somehow it's been tracked for you, like through your credit card or whatever. You can go back and look. And you can say, gosh, I'm spending, X number of dollars eating out each month. I'm going to decrease that by 10%. And then hold yourself accountable to that. Or maybe, removing one luxury you have. Now, you don't want to just make life miserable in doing that, but tracking it and seeing where it's going, right? Because the first key to being able to make a difference is to kind of know where you stand. From that point, then you just have to start making little changes. Maybe you do cut out the coffee. You might kill two birds with one stone, right? If it's a black coffee, well, you're not going to get a lot of health benefit by cutting that necessarily. But if it's like a double chocolate chip latte, let's say you have one 3 times a week, by cutting that out, you're going to save yourself probably $15 or $20, but also you're going to decrease all those sugars and carbs. So you're going to get some benefit financially as well as from a health perspective. And then you're just going to have these little small wins. Look at your credit card. Start whittling away on that and start putting that away. Don't try not to use that as best you can. The other thing is just really work to increase your health literacy. I think Dave Ramsey is a great resource. And although I don't agree with everything Dave Ramsey says, I think if people are really in financial straits and have just historically made really bad financial decisions, that's a great place to start, right? He just talks about paying off debt, sort of assessing all your debt, paying off the high interest debt, and just really kind of working to snowball. He calls it a debt snowball, and just working it so that you can work it down and get yourself out of debt. And as you start having a little bit more money each month, you can then apply that extra money to yet another credit card or a car payment or whatever. And if you can, get by with a cheaper car, it just doesn't matter. But what you want to do is, just like we've talked about before, if you say that you'd do anything for your kids, that should mean anything, which is I'm going to take care of myself, right? So that I'm present for them. It doesn't necessarily mean give them everything they need. They don't need stuff. When you talk to 80, 90, and 100-year-old people, they all tell you the one thing that really doesn't matter is stuff. What matters is relationships. So if you're alive and you're healthy and you're able to do things with your family members and engage in relationships, that's the ultimate goal. And so by making good financial choices, it helps you to make good health choices, which in turn leads to the ultimate determinant of happiness, which is just good relationships. There are so many apps and online services to help you with your financial education and financial literacy. Unless you're really in a pretty good spot, I think I would probably avoid hiring some professional help, but that's up to you. I think that oftentimes people just sort of fly by the seat of their pants when it comes to their financial health, and they don't have a budget. So creating a budget would be a great way to start. There's a podcast by a guy named Jesse Meacham called You Need a Budget, YNAB, Y-N-A-B, YNAB. I think they're about 5 minutes or 10 minutes. I've listened to so many of them. He just gets on and gives you a little 5 or 10 minute blurb on what you can do regarding different things. And if you just made that part of your daily routine, maybe while you're taking a shower, maybe while you're driving to or from work, just listening to it and just listen to it every day. I think he's got thousands of them, but I don't know for sure. But there's a lot and there's a ton of information there. And so you just hear these little things, and it does a couple of things for you. One, it's just good information. It's just good, reliable information. But also,
if you just continue to listen to that on a daily basis, it kind of reinforces the need to be intentional with your finances. And I think that's so much a part of what we need is just a refocusing on a daily basis to just stay the course. And I think Jesse's program has a feature that you can purchase, and I don't know anything about it. But if you can just listen to his podcast and don't spend a dime, that's probably great. I don't know. Maybe his product's great as well, but that's not the point. We're not looking to spend more money. We're looking to save money. So I would recommend that. There's others out there as well. You can also look at ways to increase your income, maybe a second job. But again, that really starts to be a slippery slope in terms of your health, right? Because if you're working more, then you're probably exercising less. Eating oftentimes gets difficult when you're at work, right? You're going to eat healthier more than likely when you're at home. And so increasing your income by a second job, if it's necessary, then that's fine. That's what you need to do. But if there are other ways to do that, that's fine as well. Maybe if you can get yourself debt free, then you can start investing that money and let that money grow for you. So that way you ultimately, again, over time, see an increase in your finances, but it's not necessarily creating an increase in your output. And then lastly, I just think it's important to remember that globally, the point of all this is health and wellness. And so if you just continue on your healthy lifestyle, if you have to spend a little extra money to eat healthy and you have it, that's good. And if you don't have it, start making the changes that we've talked about here today and get that. And I'm not saying take everything you spend and then start spending it on more expensive food. And more expensive food doesn't necessarily mean better food, but just healthier food. And if it's a little more expensive, that's fine. And continue your diet and exercise habits. The daily grind, just starting and being consistent with all of this, health, nutrition, and finances. Ultimately, over time, you will see the benefit. Some of these concepts are hard to grasp because you're doing everything on a daily basis, right? You're making these choices. You're listening to these podcasts and you're exercising. And maybe you get on the scale and you don't see anything. Or maybe you look in the mirror and it looks the same. Or you look at your bank account and the changes are so small that you can barely appreciate it. But just stay the course because big changes come from little changes. And so you just start making these little changes and they begin to snowball. And then one day you look up and you're going to be in a better situation. That's the spiel on financial health. I'm going to continue to incorporate financial health discussions into the podcast because I think they're important. And I understand where the correlation may seem somewhat abstract, but really the two do go hand in hand. And I'm not talking about turning yourself into a millionaire, just like I'm not talking about turning yourself into a bodybuilder. I'm just talking about doing a little bit better than you did the day before. And in the end, it all marches us toward our goal of better relationships and a better situation and ultimately increased happiness and longevity. So that's the podcast today. I hope you enjoyed it. I'd love to hear your feedback. Feel free to hit us up on our website, thebmipodcast.com, or go to in our social media outlets. We'd love to hear from you. Thanks for listening.
I'm your host, Dr. Drew Crawford. Join me next week as we go beyond measurements and image to build healthier lifestyles and elevate your well-being on the BMI Podcast. See you then. The BMI Podcast is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. Be sure to check out our description below for our website and social media platforms.